Welcome to the Healthcare Transition Training for Educators, a course provided by Florida Hats. Thank you for participating in this training program and for joining in this statewide effort to support students with chronic medical conditions and their families. As an educator, you play a critical role in assuring that your students gain maximum benefit from their time in school. Your students with chronic medical conditions rely on you to develop the knowledge, skills, and confidence to access the health services and related supports that they will need as adults. This training program is about the student's transition from child-focused to adult-oriented healthcare. Throughout this course, you will meet individuals who have already completed this process. The course uses interactive tools for you to implement the recommendations in your school. By the end of this course, you will be able to describe healthcare transition and its significance within the larger transition to adulthood, identify the educator's role in healthcare transition, partner effectively with healthcare providers, name strategies to improve student health literacy, communication, and self-advocacy, integrate healthcare transition into students' IEPs, 504 plans, and IHPs. 10 modules make up this course. Each module is about 20 minutes long. Here are some important terms used throughout this course. Youth with special healthcare needs is a phrase that is commonly used to describe children with ongoing medical conditions. Throughout this course, we use the phrases parents and caregivers interchangeably. Caregivers are the adults in your students' lives who have parental authority, such as legal guardians or foster parents. The phrase providers refers to all healthcare providers, primary care, emergency, or specialty, be they doctors, nurses, social workers, or therapists. The phrase adult medicine is a general term to encompass the primary and specialty practices that serve students beyond childhood. The transition to adulthood is a broad process. This curriculum will focus on one aspect of that process, healthcare transition. This presentation will introduce you to the topic and key concepts used throughout the course. In addition to the course's overall learning objectives, each presentation has its own. By the end of Module 1, you will be able to define healthcare transition, explain its importance for students, and describe its current state. When talking about healthcare transition, young people and their families often made the following point. Healthcare transition is not a goal in and of itself. Rather, it is one step in the larger process of achieving their life goals. Further, the process of healthcare transition supports their efforts at independence, further education, living independently in the community, and most importantly, having a life. Secondary transition refers to the process a student with a disability goes through as they move from high school to whatever comes next, including post-secondary education, employment, and independent living. As you will see throughout the course, many school-based transition services are interrelated with a successful healthcare transition. In healthcare, transition is the purposeful, planned movement of adolescents and young adults, with or without special healthcare needs, from child-centered to adult-oriented healthcare systems. Healthcare transition encompasses preparation and planning for the move to adult health systems, transfer from pediatric to adult care, and engagement with the adult-oriented providers. Preparation and planning are processes begun by age 14 that occur over time. This allows for the student to gradually increase responsibility for managing their own health. Transfer is the discrete event of changing to an adult medicine provider. This ideally happens between ages 18 to 21. Fully transitioned patients are engaged in and receive ongoing patient-centered adult care. Many IEPs, 504 plans, and IHPs include healthcare skills, such as learning to take medication independently. Special education transition services and healthcare transition preparation frequently overlap. For youth, the focus of healthcare transition is developing the skills to direct their own care. They must build a sense of control and responsibility for their own health while preparing for additional rights they will gain at age 18. Some students may never be able to make legal or medical decisions independently. Others may need a caregiver to complete physical tasks. Yet these students will all become adults. They are not exempt from transition. Preparing all students to direct and manage their care to their fullest capacity is critical. Making the transition from pediatric to adult-oriented healthcare is especially important for youth with special healthcare needs. Childhood providers play a critical role in facilitating successful healthcare transition. Their challenge is to work in a coordinated fashion so that students receive continuous, developmentally appropriate, and responsive healthcare during key changes on the path to adulthood. Through the healthcare transition, families must facilitate growth and development in their child. The process of letting their child grow and letting their child go can be especially challenging for caregivers of children with complex conditions. Successful healthcare transition is key to the overall transition. Without success in this area, all of the work towards vocational and independent living preparation is at risk. The next section will further explore the importance of healthcare transition for educators. Consider a pediatrician's waiting room. Are there ducks on the wall? Little chairs sized for the youngest patients? A pediatrician's office is surely a wonderful childhood environment, which reinforces the reasons your oldest students might feel uncomfortable there. The move to adult care promotes normal social and emotional development, supports a positive self-image and self-reliance, encourages independent living, and broadens the young person's system of interpersonal and social supports. With improvements in medical technology, the life expectancy of children with special healthcare needs is well into adulthood and, in some conditions, equal to that of the general population. About 500,000 individuals with special health needs turn 18 every year. The next two slides provide examples from specific conditions. In the 1950s, few children with cystic fibrosis lived to see elementary school. Children born today with CF have a predicted mean life expectancy into the early 40s. As of 2012, more than 45% of the CF patient population is age 18 or older. Life expectancy for people with Down syndrome has increased dramatically in the last 30 years. In addition, people with Down syndrome experience accelerated aging in their 40s and 50s. This increases the importance of their transition to adult medicine. A pediatrician is not equipped to provide geriatric care. Perhaps you do not see many students with complex conditions like CF or Down syndrome. Think about other, more common conditions in your school. Students with comparatively simple conditions must also learn to manage medications, navigate insurance, and access specialty care. Many students experience gaps in healthcare access, increases in symptoms, and decreases in independence if their healthcare transition goes poorly. Conversely, taking time to properly address the healthcare transition leads to positive overall transition outcomes. Most students encounter multiple transfers and transitions between the ages of 18 and 26. Preparing for the healthcare transition should be a natural part of these changes. Research shows that successful transition to work and independent living require, in part, the student's good health. So addressing the issue of healthcare transition will contribute to their ability to fully participate in their community. Throughout this course, you'll see slides like this one with interactive questions. Each interactive question slide will help you connect the material with your day-to-day work with students. Take a moment to consider these questions. What transition planning do you already complete with your students? How does health affect their overall transition to adulthood? Writing down your response to these questions will help you prepare for this course's final activity. The presentation will automatically resume in 1 minute. We've seen the need for healthcare transition, Now let's look at evidence on the current state. Does it need improvement? Discharge from pediatric care is frequently abrupt, without planning or preparation. Rather than being based on a young person's readiness to negotiate the adult healthcare system, discharge is often precipitated by external factors. These include hospital or insurance policies limiting pediatric care to children, typically under age 18 or 21. In some cases, transition is prompted by displays of adult behaviors that pediatricians are not prepared for. In these situations, transition takes the patient and parents by surprise, leaving them with a feeling that they've been kicked out. In the current state, healthcare transition outcomes commonly fall into one of the following categories: everything stays the same, mixed transition, full transition, or dropping out. Some students continue to receive both primary and specialty care from the same providers and facilities after they reach age 21, so their care seemingly stays the same after they reach adulthood. Frequently, individual providers have no formal policies about transferring students based on age. When those policies are in place, pediatric providers continue to see their adult patients by requesting an exception or by simply ignoring age-related policies. How would you react to a teacher who wanted to let a student continue attending school into their 40s or 50s? Some youth transfer their primary care but continue to see their pediatric specialist. There is a known shortage of adult-oriented providers familiar with childhood onset conditions. This shortage causes difficulty in finding adult specialists who accept transitioning students. For example, many adult pulmonologists are not familiar with the care of individuals with cystic fibrosis. Remember, youth with special healthcare needs are an emerging population in adult medicine. We will discuss this barrier to transition in greater detail later in the course. Key to a successful full transition is careful planning, the development of healthcare skills by the student, and good communication between all of the providers. Some youth fall through the cracks. Dropping out from childhood care is most likely to occur upon discharge. Dropping out of adult medicine is more frequent if the student experiences an early barrier with new providers. Many pediatricians never find out if their former patients drop out of care. They are not aware of the size or significance of this problem. In later modules, we will examine how to avoid this outcome. You may only learn about problems with healthcare transition if your students experience a crisis related to accessing care. Have any of your students transitioned to adult care? Experienced an abrupt discharge from pediatric care? If yes, what factors have led to their discharge? Did they know or understand the reasons? Take a moment to consider these questions. The presentation will automatically resume in 1 minute. Next, we will examine healthcare transition barriers specific to educators, providers, students, and caregivers. Many child-focused providers do not know how to broach the topic of transition, afraid of the patient's reaction. Other providers, sensing parents' fears of the unknown, don't know when to broach this topic. And if the pediatrician lacks a strong referral network in adult medicine, they may not want to begin the process at all. Most importantly, the majority of providers have limited knowledge of school-based transition activities, leaving them unaware of the existing structure for students' transition preparation. Many providers inadvertently create new barriers, trying to avoid the others. External factors often step in to create an abrupt transfer, such as during a medical crisis. Additionally, providers develop a bond with their patients, especially those with complex conditions. Some pediatricians go so far as to explicitly promise not to discharge or transfer care. This makes an abrupt transition even more calamitous. Some providers direct communications solely to the caregiver, thus leaving the patient unprepared for adult medicine, where parents are typically not part of the visit. Finally, many childhood providers do not include educators in care coordination activities. Ironically, this creates both duplications and gaps in the student's healthcare transition preparation. Adult-oriented providers, such as internists or cardiologists, are less familiar with childhood onset conditions. They may mistakenly believe, for example, that only children can have ADHD, or that people outgrow some childhood conditions. Some adult doctors also say that they are unaccustomed to working with a patient's parent and are unfamiliar with education and VOC programs. Your students are probably not excited about reading their insurance paperwork, learning how to find an in-network provider, or going to the pharmacy on their own. The main barrier for youth is the fact that healthcare is boring and complicated, yet vitally important. Many families do not understand why their child cannot continue to receive care from childhood providers when they reach adulthood. They do not fully appreciate that pediatrics is a specialty, trained in the care of children and adolescents, but not of adults. Their fears that the child will not properly manage their condition or that the new provider does not know enough about their child's condition is their main barrier. Many educators are simply unaccustomed to explicitly addressing healthcare transition in special education plans. Educators and healthcare providers both lack pathways to coordinate with each other in a meaningful way. Finding ways to include them in existing routines without increasing workload is a main barrier.
I think from my experience, I can definitely recommend to others going through the same thing not to give up. There are going to be times that it's going to seem so overwhelming and so insurmountable to be able to do this by yourself that you're going to want to quit, but don't do that. I think another key thing to think about is get involved early. Become integrated with your healthcare very early on in life. I think.
When you say integrated, what do you mean? Can you give examples?
Well, when I say to be integrated, I mean like instead of having your doctors talk to your parents or just to your parents, have your doctors talk to you. The patient, because after all, they're performing the surgeries or what have you on you. So that is that's more or less what I mean by becoming integrated. Is just take charge almost. I mean, it's your healthcare. You should really be the one playing the key role in it.
Any other recommendations?
I think just keeping a positive attitude. I think that's really what it's all about.
To be successful, healthcare transition must be a long-term planned process that attends to the medical, psychosocial, educational, and vocational needs of the student as they move through adolescence into adulthood. In the next section, we will discuss the connections between the healthcare transition process and education. Due to growing need, healthcare transition is a national priority. Improvements in transition care are built into the Healthy People 2020 goals. The reality of transition is reflected in federal laws, like the Americans with Disabilities Act and the Individuals with Disabilities Education Act. The National Center for Healthcare Transition Improvement, established by the U.S. Department of Health and Human Services Maternal and Child Health Board, provides resources to achieve these national goals. Transition planning for youth with special healthcare needs includes the development of self-management and decision-making skills to foster active participation in maintaining their own health. It is a priority among professional organizations and within federal law. All of the different special education programs available to youth with special healthcare needs focus on developing skills. Frequently, they also prepare students to transition from one phase of life to the next. Even students who receive services for a short period of time gain knowledge or skills related to healthcare. Beginning by age 14, IDEA requires that the IEP include a statement of transition service needs. Transition services are a coordinated set of activities that promotes movement from school to post-school activities, including post-secondary education, vocational training, employment, continuing and adult education, adult services, independent living, or community participation. Lack of attention to health needs and health management can jeopardize goals for learning, working, and living safely in the community. Florida laws mirror IDEA. Transition services begin by age 14 or earlier and may not end until 22 for students with significant disabilities. Young adults need to know how to manage their own health, access and pay for medical services. Therefore, instruction that improves an adolescent's ability to take responsibility for their health needs and to work effectively with new healthcare professionals are included within the scope of transition services. More than any other group, educators have the most resources to help students develop healthcare skills during transition. Many secondary special education programs use the gradual release of responsibility framework. This emphasizes a scaffolding for skill development over time with plenty of opportunity for practice. Whatever framework you use, individualized plans and services are the hallmark of special education skill development. In this section, we will discuss general guidelines to introduce this topic with students and parents. The earlier the process begins, the more likely students are to take responsibility for their own care as a young adult. It is best to introduce this topic around age 12 and no later than age 14. These 8 steps are the heart of the healthcare transition process. As you will see, there are many parallels with educational transition services. These 8 steps will organize what to discuss with families and how to coordinate with healthcare providers. This algorithm maps out the 8 steps of the healthcare transition. It identifies specific tasks in the process by age with considerations for youth with special healthcare needs. This is the Florida algorithm for youth and young adults with special healthcare needs from Florida Hess. It closely matches the national algorithm you just saw. The Florida algorithm includes state-specific considerations and tools. We will use this guide throughout the course to implement the 8 steps. The Florida algorithm provides age-appropriate steps for all stages of adolescence. Use this framework as a guide to individualize your healthcare transition discussions with youth and families. Before closing this module, let's look at resources for your school. The Florida Hats website has the latest news and tools on transition. The toolbox offers practical resources for multiple audiences. There are 4 regional coalitions within Florida Hats: Tampa Hillsborough, Northeast Florida, the Panhandle area, and South Florida. These regional coalitions can link you to local resources. Children's Medical Services Managed Care Plan is a division of the Florida Department of Health. It has nurses, social workers, and other staff who can provide information to teachers, either one-on-one or in group trainings. For those students who are enrolled in the program, CMS plan staff can facilitate communication between the child's healthcare providers and school staff. Later modules will provide further details on CMS services. The National Center for Healthcare Transition Improvement's website is called Got Transition. It provides national news on transition research and events. GotTransition.org also provides a database of tools and resources. Filter the database by tools for youth, for families, for providers, or by state. Throughout this course, you will see these key points from the introduction. We've already discussed these key tools. Use the links from this course's toolkit to download or print copies for use during the course. Now that you are familiar with the basics of healthcare transition, let's examine the relationship between transition and adolescent development in Module 2. You can pause the presentation for a quick break or continue directly on to the next module.